welcome to Your Family Dog, a podcast dedicated to helping families love living with dogs. Here are your hosts, Julie Fudge-Smith and Colleen Pilar.
Hi, and welcome to Your Family Dog. I'm Julie Fudge-Smith, and today Colleen Pilar has a minor family emergency and can't make it, but I have a special guest, Dr. Jim Carlson, who's a veterinarian in Columbus, Ohio. He is a 1993 graduate of the Ohio State University College of Veterinary Medicine, and he began his veterinary career doing mostly Western or conventional medicine. As with many veterinarians, he became dissatisfied with some of the responses he would get from the traditional approach, so slowly he began to integrate other types of treatments, such as nutritional medicine, using products like glandulars and whole body supplements from Standard Process. He began practicing traditional homeopathy, and in 2003 added homotoxicology, I hope I said that right, to his repertoire. In 2004, he attended the Chai Institute to be trained in traditional Chinese medicine and acupuncture, and has been certified since 2005. In 2006, he became certified by the Healing Oasis Wellness Center and by the American Veterinary Chiropractic Association in veterinary spinal manipulative therapy in 2007. So he has a general practice called Lifetime Pet Wellness, and they've added laser therapy and pulsed magnetic field therapy to their repertoire. I will say that I have used pretty much everything that you offer, I think, Dr. Carlson, on my dogs. I have used acupuncture and chiropractic and laser therapy and pulse magnetic field and ozone treatments, and we've used a variety of supplements from you. So I have found that it's been really beneficial as a supplement to my dog's wellness. But I am a bit curious about what drove you towards it. What was dissatisfying about Western medicine for you?
Well, when I first graduated, I really didn't know anything about integrative medicine. And I really didn't even know it existed. I hadn't even been to a chiropractor myself. And I certainly could have used one after car accidents. But I was actually surprised to find out Ohio State actually had somebody who was, when I was in vet school, had somebody certified in acupuncture, but no one said anything about it. No one said a word. Wow,
that's kind of interesting.
Yeah, it wasn't accepted at the time. But so I went into, I went in with my first jobs, doing what everybody does, doing your conventional medications, your surgery, your dentistry, and you definitely are helping patients when you're doing that. But to me, I started seeing some of these charts for these animals that's when we had written charts, not computers.
Oh, back in the good old days when we actually used pen and paper, you mean?
Yeah. So, but I started looking at some of these charts that were, an inch or two thick for some of these patients. And I just wondered if there was something else that could be done, especially earlier in life, that might help us avert some of these issues, or something when the issue does arise. Is there something that can make us, help us actually cure the pet, or at least make them much healthier and not have all these different medications, and then you have to put on other medications that will help the side effects of those medications, and so on and so on. So
right, so you get this accumulated effect of medications, and they start interfering with one another, and pretty soon you're not even treating the original problem with the dog, you're treating all the residual problems that happen from this accumulation of side effects. And
right.
And so one of the things that I think is frustrating sometimes, I think, for a lot of veterinarians, is that on some level, you're just treating symptoms. You're not treating the underlying organic cause of the problem with traditional medicine. And so I think that that's one of the reasons why a lot of people turn to alternative medicine, because they feel like we've tried everything, and we're not reaching what we need to reach, which is the underlying cause. Now, do you find that some of the alternative medicines are better at addressing underlying causes?
I would say the other, and that kind of goes to the other challenge that I found in practice was that I hate hearing that there's nothing that we can do. Just take your pet home and to make them comfortable for the next month.
Right.
So I feel that there are some things that we can, that integrated medicine definitely excels over just conventional medicine. Like I've got a dog that comes in now. It's a shepherd. It's in liver failure, and its liver is very small, and it has a shunt, what they call a shunt, where the blood. What the liver does is it does many things, but one of the main things it does is when you digest your food or absorb the things that are in your gastrointestinal tract, it goes to the liver, and the liver filters that out. Mm-hmm. And then after it filters out, then it goes up to the heart. Well, if your liver is small and that the body makes channels around that, so it's called a shunt. So it actually bypasses the liver without getting filtered, and it goes back into the body. So so the shepherd came in, and he had small liver, had these shunts, and was told by one of the specialty clinics here in Columbus, basically take him home, and he's probably got about a month. And I think we're out 8 months now, and he's got his weight back. He's eating well.
Wonderful.
He's doing phenomenal. And it goes back to sort of that, what they call that innate intelligence. If you give that body what it needs to heal, then you can fix a lot of issues.
So what did you do for this shepherd in particular?
Well, usually we'll start with diet. Do some sort of liver diet, whether it's homemade or whether it is a commercial brand. I prefer homemade over commercial, but for this guy we did both. And then put him on a bunch of standard processed supplements, some Chinese herbs, and some homeopathics. And he was also getting nosebleeds, so he was on an herb for bleeding.
Okay.
And so he's doing phenomenal, and then we're real happy with how he does. That's just one example. The liver has amazing regenerative capabilities if you give it the right stuff.
Oh, that's interesting to know. So one of the things that I have found is that the chiropractic adjustments that you have done have made a big difference in just the overall comfort level of my dogs. And every time you adjust one of my dogs, I'm thinking, I wish he did human medicine because you are so gentle in your adjustments. But one of the things that I think is that people don't think about is the maintenance, is that you can actually maintain your dog's health and prevent stuff by having regular things like chiropractic adjustments and throw in some acupuncture. I know with Bingley, acupuncture was really essential in helping him through his cancer treatment to be more comfortable and to help his appetite and just, decrease some of his pain. Chiropractic can be more than just maintenance, though. I know that Zuzu had her very first one, not from you, but from another one, at 3 weeks of age, and that is what allowed her to bend properly and feed better because she hadn't been eating well. So could you talk a little bit about some of the things that might apply to your average family dog that would help them to be more comfortable, healthier, and maybe even live longer?
Integrated medicine, you think of the whole body. You think of, and I try to do long term. I try to get them in before we have these big major illnesses, or that, now we've got metastatic cancer all over, things like that. It's better to start as a puppy or a kitten. But I'll always start with diet first. I think diet is very important as far as getting the most natural possible diet that you can, whether that's I'm a big proponent of raw food.
I am too, actually.
Yeah, so I love raw food. It's not for everybody. That certain households shouldn't have raw food in it if you've got anyone immunocompromised or For an old patient that's never had raw food before, might not be a good idea. But so raw food or homemade food. And then I also feel that I think most dogs and cats should be on probiotics and enzymes, and probably extra fish oils or omega-3s of some sort. Probably not flaxseed, because I don't think they digest flaxseed very well. But so I'll do that, and then I look at chiropractic as the next one, or spinal. We're really supposed to call it spinal manipulative therapy, but most people don't know what that is. So it's a form of chiropractic.
Right.
And because with that, then you're basically keeping the joints moving well. When the joints move well, then the nerve output and input to the spine is normal. The brain stays healthier. The internal organs stay healthier. The endocrine system stays healthier. And the funny thing is that I first learned, I went with acupuncture before chiropractic.
Okay.
It was, I don't know, to me it didn't really make as much sense to me as acupuncture. But since then, my view is reversed. I will almost always do chiropractic or adjusting first, before I'll add in the acupuncture. Just it depends on the case, but I just think that there's so much that keeping the spine and the other joints moving well, and in proper conformation, is best for health. So.
Well, and I think that when you're talking about, I think that chiropractic is so wonderfully juxtaposed with diet. I think they work so well together, because the fish oil, I think, is just really critical for, fluid joints, and so then the chiropractic keeps the joints fluid too. That I think they work really well together, and I think that is the real beauty of integrative medicine. Is it truly is integrative, that it is looking at the holistic approach to the dog and looking at what are the things that we can do to work together, rather than pinpointing one specific thing that we're going to look at, which is the more traditional approach in Western medicine. Is we have a skin problem rather than we have a health problem, or we have arthritis, so let's go straight to Rimadyl, where there might be other things that we could do that are not going to have some of the same side effects. On the other hand, I don't think that you have thrown Western medicine right out the window. So I think that you have do a very good job of integrating integrative medicine into Western medicine. So can you address that a little bit more about how you use integrative medicine to enhance more traditional medicines or treatments?
Yeah, there are several different forms of integrative medicine, what people think about. And that can be more of a holistic, where you look at, you use all the different modalities like we do, but you have other people who might just focus on acupuncture or might just focus on homeopathy. So there's many different ways of doing it. We do all three, because I think especially dentistry has become really big. You have to keep the mouth healthy. If it's loaded with bacteria, the kidneys are going to be strained throughout the life. You could end up going into failure. You could. There's argument that the bacteria could seed a valve on the heart, and then you end up with a heart infection, things like that. So we always add in dentistry's very big, but as far as different things that we will integrate, I try to for my pain control. A lot of times I'll use a homeopathic with tramadol, because tramadol is a pain reliever but not an anti-inflammatory. So I'll use a homeopathic that's an anti-inflammatory with the pain medication that can seem to help for a lot of dogs and cats. The other, I would say, is certain cancers. Especially lymphoma. Lymphoma is one where a lot of integrative people believe that lymphoma is going to respond better to chemotherapy, support the patient with integrative means to keep the side effects down.
Right.
Because with lymphoma, they go in for their first treatment, the lymph nodes are down the next day, almost back to normal in a lot of cases. So I would say that's one. For kidney disease, many of those, we will always. I always look at what can I add in that's going to help, not just cover the symptoms, but like you mentioned earlier, hit the base of the problem.
Right.
So.
Right. Well, I was thinking some of the other things that we did, like when Bingley was diagnosed with cancer, we added in the ozone treatment, which I think was really helpful, and in making him more comfortable, but also just helping him recover from and not be as severely affected by the chemotherapy as he was. He really handled his chemo well, and I think part of it was because I continued with the acupuncture and the chiropractic, and we added in a few other things. So you want to talk about some of your more unusual treatments, like the ozone treatment and the pulse magnetic treatment, what those are and how you use those?
Yeah. I would put in there also laser. But a lot of people are familiar or getting more familiar with laser medicine. The ozone it's where we take medical grade oxygen and turn it into ozone. We don't use room air for ozone generation because you make a lot of toxic compounds. The interesting thing is that in most other countries, or many other countries at least, ozone is a standard of care.
Is it?
Where
That's
in the
interesting.
U.S. it's still, so where in the U.S. it's still considered integrative, and probably the reason why most people say the reason is because no one can patent it. Yeah, so and actually the first, there were ozone hospitals here in the U.S. I believe in Tesla, was the first one who made a commercial ozone generator.
Really?
Yeah. So
had no idea.
Yeah. So Spain, Russia, Cuba, Italy. Many of these Germany, many of these countries are using ozone all the time, especially since we're coming up against some of these super bugs that are resistant to a lot of bacteria, antibiotics.
Right, which is pretty scary stuff.
Yes, and so ozone, as far as administration, it can be done many different ways. Probably the most common is. Probably the most common is rectal insufflation, where it's almost given like an enema. Okay. The second one is the auto hemotransfusion, which is what we did with Bingley. I think we did both, actually.
We did do both.
You draw out. With that one, you draw out some blood. You put an anticoagulant in it so it doesn't clot. Dilute it with saline, and you treat it with ozone, treat it with ultraviolet light, and then you give it back to the patient. Other ways it can be used topically. We can ozonate saline, so you could use it in the eyes or given subcutaneously. So there's several different ways to use it.
And what does ozone do for a patient?
So it does many things. But basically, it's cancer hates oxygen. One of the theories that we get cancer is because we don't have enough oxygen in the tissues. Okay. It's effective against fungus, bacterias. It stimulates, if you have areas of the immune system that are hyper stimulated, so like an autoimmune disease.
Oh, okay.
It can help modulate the immune system, so it can bring that excess immune system down. But at the same time, if you have deficient areas of the immune system, it can stimulate the immune system to bring it back up. So it works to modulate, not make excessive or anything like that.
Right, which is why it can be used, I think, in conjunction with something like chemotherapy, because it's not really directly interfering with chemotherapy, it's supporting it. Is that correct?
Right.
Okay.
When you get the chemotherapy, the oncologists will say that chemotherapy, you shouldn't be giving antioxidants with it because it works by creating oxidation species, I guess. But there are several integrative oncologists that will use antioxidants with chemotherapy, and the patients they seem to stay healthier. One of the things that ozone, it sounds kind of odd, but because ozone, you think of ozone as this big oxidizer, but what it actually does is one of the things it does helps the body's antioxidant system improve and normalize. So if we're short on antioxidants, it'll help bring that level up naturally. So it does so many things.
It does sound like it does a lot of amazing things. It seems to as though it works with the body, with what the body needs. That's what it's going to work with, and that's pretty cool.
Exactly, and it's not necessarily a cure-all by itself. It tends to work best, in my mind, with an integrative plan. When you put other things.
Right.
Well,
so many of these things work better in conjunction with one another. Like, the joint manipulation works better if your dog's on fish oil. And, ozone's going to work better when it's in conjunction with things that are going to support the body in other ways. And certainly a good diet with, appropriate proteins and all the other things that dogs need are going to help to maintain a dog. One of the things that I think why when both of my dogs got cancer last year, why they did as well as they did was because underneath the underlying cancer were two very healthy dogs who'd been on good nutrition all of their lives and supplements. And so I think that when you can build a healthy dog underneath, that when things like cancer happen or other illnesses happen, then you have a much better fighting chance of having some of these integrative medicines work as well as the traditional medicines work, because you've got a healthy dog underneath all of this. And that's the whole point, I think, behind integrative medicine, is to produce the healthiest dog possible underneath, so that when things happen, you are going to be much more likely to be successful in counteracting it. Is that a good summary?
Yeah, I mean, you've got two main things that make us who we are, and one is genetics and one is environment. And I put in environment, I put good diet. Actually,
yes, I would too.
Yeah. So you can't really do a whole lot about your genetics, but when you have a better diet or in better environment, less toxins, that sort of thing, then you get less of those bad genes being read. So our goal is that you stay healthier longer. And I think those, I don't know if anyone's ever heard of Pottinger's cats, the Pottinger's cat study.
No, at least I have not.
So Pottinger's cat's a great read as far as if for anyone who's, well, it's an interesting read. I won't say it's a great read, but it's if anyone basically looking at if there's a real benefit to raw food.
Okay.
And he basically did a study with cats that he was looking at one thing and found out that his colony of cats were getting sicker when they were on this processed food. So then he made it into a study. And basically over 4 to 5 generations of cats eating processed food found that they started becoming unhealthy, having a lot of recurrent health issues, and each generation was sicker. Versus comparing that to a group that is just being fed raw food, they stayed healthy and maintained their cat-like appearance. And then when they found that it takes several generations. When you switch them over to raw food, it takes several generations for them to they can get back to health. And that's one of the arguments right now with humans, is that the generation, our young generation coming up now is now that 4th, 5th generation of Pottinger's cats, and of processed food. And you see what our health does, and I don't know how. I that way as humans as well. We're and with pets that are on these processed foods for so long, they're just getting sicker and sicker with each generation.
Yeah. That makes a certain amount of sense. It was interesting. A friend of mine was, when they renovated their kitchen, they pulled a counter out, and what they found behind the counter was a grocery list. And this must have been from like the 1950s. Oh, but what was really interesting is what was on it was milk, flour, eggs, fruit, lettuce, meat. There was not a single processed food on the entire list.
Yeah.
And so I think to myself, wow, we have really changed, because how many of our, lists are, cornflakes and bread, not the flour to make the bread, but, the bread. And so I think that there's a lot to be said. And I think,
Twinkies.
Yeah, that's right. I also think, too, that one of the problems with current health is not just, even if you were to eat raw, I mean, what are we feeding our cows? We're feeding them corn. That's not what they're supposed to eat. They're supposed to eat grass. And so I think sometimes we are really altering the food chain by what we're feeding the things that we eat. And that can make a big difference into how we process foods.
And I don't know if you're familiar with Mercola.
No.
But Mercola is integrated medicine. Now he sells his own products, but he also has some really neat articles, and then his counterpart, Dr. Becker, is on the veterinary side.
Right.
So she also has some really neat stuff. They have newsletters that you can get emailed to you. But he really looks at Alzheimer's and those he thinks that one of the why Alzheimer's is growing so rapidly in humans is because of these massive cow lots and the stuff that they're being fed.
Huh.
In Chinese medicine too, the beef is usually more neutral if they're fed grass. Mm-hmm. If it's cattle and that have been fed just grains and corn, the energetics are more warmer to hot. So even the Chinese have even seen this, in food energetics.
Wow, that's very, very interesting. What we'll do for our listeners is we always have some follow-up notes and links, so we will get links to some of Dr. Mercola's and Dr. Becker's articles. If you want to send me those, I'll make sure they get on our website, as well as we'll get a link to Pottinger's cat, because that people might find that to be interesting as well. Mm-hmm. One last thing I wanted to talk to you about was the idea of what is the pulse magnetic, because I had no idea what that was about when I came in, and I did find that it helped with lameness in Bingley. So if you wanted to just talk about that, and we'll wrap it up.
Yeah, that pulse magnetic uses healthy frequencies of magnetic energy. And there are many different brands and versions of it out there, ranging from some people say it's better just to have the magnetic energy of the earth, as your stimulating energy, which I don't believe, because we get that all the time. Or you use stronger pulses. And so what this does is it uses a pulsing device that gives you a pulse of energy, and you can adjust it, the strength and the quickness of the pulses. And when you do that, you're altering body chemistry. Mm-hmm. That eventually ends up doing several things that clinically, anyways, that laser does. Mm-hmm. So it'll decrease swelling, decreases pain. increases blood supply, increases healing. It's what I prefer to use on my lower back when it's bothering me. It's not contraindicated in cancer or tumors like laser is. Laser's generally thought to not be used anywhere you know that there might be cancer.
Right.
So it has a lot of different effects that can work similar, like I said, clinically to laser, but it just uses different methods to get there. And it's been used for years. I would say it's probably more common in the horse industry.
Yes, I would. I have used it on horses before I used it on my dog, and I didn't realize what we were doing.
Yeah, some of these units, even like ours, you could put on a horse to where they're getting muscle contractions where they bounce. Obviously, small animals don't put up with that, so you use smaller levels of energy.
Yes.
But I have a lot of agility people come in, do it before an agility core trial, because you've also got the quantum physics side of it where it's imparting an energy. So a lot of people feel that they feel more energetic, or if you do it on a pet, the pets feel more energetic at the same time. So there's some things in there we probably can't totally explain unless you believe in quantum physics. So.
All right. Well, I don't think this is time for the quantum physics lecture. I certainly know I could not explain quantum physics. But thank you very much for coming along and talking with us about alternative medicine, or integrative medicine, which I think is a much better expression, a way of describing it. I think most people think of it as alternative, but integrative, I think, is a much better way of looking at it, because it's the whole idea of integrating things into your pet's health care that will help to maintain it and make it healthier for a longer period of time. And certainly we all feel our cats and dogs live far too short of lives, and anything we can do to make them more comfortable and healthy and live a longer life is something I think a lot of people are interested in taking a look at. If I'm lucky, I have lots of wonderful veterinarians in my area, but for those of our listeners who may not be as close to an urban area as we are, is there a place that they can look up holistic practitioners, acupuncturists, or chiropractic doctors? Is there any kind of a national online directory or anything like that where they might be able to find somebody?
There are a couple. You can do the ahvma.org, which is the
okay,
and that's the Holistic Veterinary Medical Association. I hope that's the right one, but you could also just Google American Holistic Veterinary Medical Association. You can also do tcvm.com is the Chi Institute, and they have a locator on theirs.
Okay, great.
The Healing Oasis I think it's .edu.
Okay.
That's where I learned chiropractics. He has a list of members, certified members there. So there are a few different places to go.
Well, great. We'll make sure all those get on our website as well, and we will also link to your website. So for those of us for those people here in Ohio, they'll be able to find the Lifetime Pet Wellness Center, which I'm so glad I found.
I was wondering if I could add in one little thing too about.
Sure.
So with the integrated medicine, you're going to find there are some challenges as far as, number one, got to get the medications into the pets. So whoever you're working with, and if these are being prescribed, please let that person know if you're not able to get the medications in, so they can come up with something else, like find a solution. That's one of the challenges. The other thing I'd say is that there's so many things out there on the internet, and some of them are garbage, and others are good. Usually, if you're paying, if it's very cheap, if it's not a homeopathic and it's very cheap, it's probably, there's a good chance that the reliability or quality is not going to be as good, because the cost is usually not them just trying to get more money from you, but it's that they're they're likely putting more effort into quality control testing and toxicity testing,
Right.
and making sure the active ingredient is in the herb, things like that. So don't jump onto the first one that looks great. Get recommendations from other people who have used it. Maybe even contact the company and make sure that they do quality control and make sure these things aren't loaded up with heavy metals or something like that. So that's
Right. And as is usual, it's kind of, you get what you pay for. You're going to buy cheap, you're probably not going to get what it is you're really looking for. So those are two great pieces of advice. And one of the things I learned from you is I now use all natural peanut butter to distribute pills to my dogs. I no longer use any with hydrogenated vegetable oil in it. So it's a little bit of a soupier mess, but we get it down.
Yeah.
We get it down. So
awesome.
So thank you for that. I was like, okay, well, I guess they can have the same peanut butter I get. So we have this big jar that's just the doggy peanut butter, but it's pretty good stuff. So thank you for that. And thanks again for coming on Your Family Dog. And you have a great rest of your day.
Thanks for having me. You too.
Thanks for listening to Your Family Dog. Got questions? Interesting ideas? Colleen and Julie would love to hear them. Call 614-349-1661 or visit www.yourfamilydogpodcast.com to share your thoughts.